And welcome to my channel. I am Dr. T. I'm a nursing professor with almost 2 decades of nursing experience. And today I'll be sharing with you 5 tips for nursing students who would like to study and become successful in their exams. This is for nursing students who are 18 years old or even 48 years old, and this may be your second career. This video is also targeted to international nurses who are preparing to sit the NCLEX exam. Now, stay until the end because the last tip that I'll be giving will save you from burnout. Now, nursing school can be tedious. Nursing school can make you feel as if you don't know anything. But rest assured, this is just a phase. And with the right study guide and a study tip, you will get through nursing school like a breeze. I am your study guide and I will help you. Welcome to my channel, The Next Generation Nurse. Now, the tips that I'll be sharing with you today actually works, and it will help you to be more focused and more organized with your studying. These are not just things that I teach as a professor. They are study tips and tricks that I've used myself throughout my nursing career during my time of studying. Now, the first tip that I would advise nursing students is to stop memorizing and start understanding content. One of the biggest mistakes nursing students make during their nursing school is trying to memorize everything. Now, I see it every semester. Students memorizing lab values, drug list, and slides word for word. Then they're blindsided when the exam comes by. Now, here is the truth. Nursing school does not test memory. It tests thinking and application. Instead of asking what is the normal value or the normal range for a particular lab, ask what happens to the patient if this goes wrong. When you understand the way you can answer the question, even if you have never seen it before, understanding the why will shift your perspective. This is especially important if you've been out of school for a very long time, or if you're always a straight A student and now you're in nursing school. Now, understanding beats memorization every time. Tip number 2, study in short, focused slots. Long, distracted studying will not take you anywhere. Let me be honest with you. Studying for hours does not matter if you're not focused. You're just spending a lot of time in front of a book. Your brain learns best in short, intentional sessions. I would recommend you study 30 to 45 minutes. Focus on your study goals. Then take 10 minutes for a breakout session. Then you repeat this. Now, this will work whether you are studying late at night, after work, if you are a second generation or second degree student, or between classes on campus. And during your break time, I want you to get up and move. Hydrate yourself. Don't just sit idle and scroll on your phone or your laptop. One focus hour is more powerful than 5 distracted ones. Study tip number 3. I want you to learn from my nursing school mistake. So I'm going to share a personal example with you. When I was in nursing school and I was studying for finals, I sat in a group with 7 other nursing students, and we had goals. We planned what we would have studied within a 2 hour block. Now, at first, it sounded like a great idea. Everyone was enthusiastic, energetic, and ready to study to pass the exam. But when we met together, my colleagues were talking about food, making weekend plans, complaining about instructors, and they were stress bonding. And this did not resonate with me. I didn't learn anything. It was just a waste of my time. We never completed what we planned to do. And therefore, I decided that this does not work. And I left the group because I was feeling tired, I was stressed, and I was not learning anything. Now, if groups doesn't work, it's okay to exit and study by yourself, just as I did. And it's not because the group was bad and there were bad people in the group, but it was because the group did not serve my goals and I wanted to pass my exam. I had 3 years in nursing school and I wanted to be successful. So you should focus and be in a quiet space and be intentional when you're studying. And my understanding and my confidence improved when I started studying by myself. Now here's the lesson that I've learned. Not every study group is a good study group. You have to have discernment and you have to understand what your goals are and what you're trying to attain. Study tip 4, you need to choose your study environment that will serve your goal. Some people learn best in groups. As I said, it didn't work for me. Some people learn best alone. And both study methods are fine, but you have to be honest with yourself when you're studying. Now, if you study in groups, try to avoid distractions, right? Because it will increase your anxiety or it will keep you from finishing your task. It will be okay to walk away. For older students, this is especially important for you because time is limited. With multiple family obligations, you need to have focused time. For younger students, learning to protect your focus early will help you long term. Your future patients do not benefit from loyalty to distractions. You will be held accountable for your patients. And tip number 5, study like the NCLEX starts now, at the beginning of your nursing school. Every exam you take is preparing you for the next generation NCLEX exam. That means you must practice questions daily and early on into your nursing program. You need to read rationales even when you get the answer right, because you will understand why the other answers were wrong. Practice questions makes you feel uncomfortable, and that is normal. Discomfort means that you are growing and that you're expanding your knowledge and you'll be thinking like a nurse, because you're training your brain to be a nurse and not a nursing student. My bonus tip is, as I always say, self-care is not a strategy, it is not a luxury. You need to understand this clearly. Being a burnt out student will not help you to perform well. Self-care is not just about spa days and candles. It's about having adequate sleep, having adequate nutrition, setting boundaries with your friends and family, resting without guilt. This will help you especially. Now, if you're older and you're an older student, juggling family, jobs, and other commitment, and for the younger student pushing themselves non-stop, I want you to ask yourself weekly, Am I sleeping enough? Am I eating properly? Am I resting at all? Your degree matters, but you matter more. Many nursing students stay up at night, burning the midnight oil, not having adequate sleep, and during the day, they cannot function well. They may develop anxiety, fear, and stress, and it will all defeat your purpose of being in the nursing program. Now, if this video resonates with you, please share it to another nursing student, an international nurse who's preparing for the next generation NCLEX, or for our older nursing student who's back in school. Or if you're an LPN and you're transitioning into the RN realm and you're looking for study tips, you're at the right channel. Please like, subscribe, and share. And this has been the Next Generation Nurse. Thank you for watching my channel. As I usually say, keep flipping the page of success, and I'm here to help you along your journey and keep clocking it, okay? You've got this. You will be successful. I know you can. Bye.